and welcome to the Art of Being Human. We've been talking about drugs. I've talked about heroin. We have a number to go because the drug problem is so bad everywhere. But in the state in particular, we're losing one person a week due to heroin use. And I hear it all the time. So-and-so died of an overdose. He was only 17. He had his whole life ahead of him. So we want to go into that. But I thought today I would take a little bit of a brief break and go into tobacco. Because tobacco is an issue if you're smoking or if you're smoking a lot. It can damage your health. Now, I'm not saying that the brain's going to decrease in size and that you're going to, pass out at the wheel or anything like that. But since so many people do smoke, that I decided that maybe it would be good to do a segment on smoking. 71.5 million people use tobacco. 23.4% of them are men, and 18.5% of them are women, and 44% of those who smoke are between the ages of 18 and 25. Now, I see a lot of elderly people smoking too, but that's the age that they give as the average age for most smokers. It's interesting that when I had my heart problem and I had a quadruple bypass, I had to go in for pre-op tests and so forth to make sure that I was strong enough to go through the procedure. And they had in this building, there was a specialized building just for heart care. And it was a big, huge hospital. It was a very good hospital. I'd go there again in a minute if I ever needed to have more heart surgery. But they had the special building just for heart care. And there was a man who had come out of that building. He's in a wheelchair, and he probably had just had heart surgery a few days before, or he was going to have heart surgery. He was wearing a hospital gown. And just outside of the building, I saw him come out, and what was he doing? He grabbed a cigarette. He was smoking. And I thought to myself, why would anybody be smoking if they're going to have heart surgery, or if they've just had heart surgery? But he was hooked on it. It's very, very difficult to get off cigarettes. It's just as difficult to get off cigarettes as it is to get off drugs. But cigarettes can be dangerous. They can hurt you. They can destroy your blood vessels. Whenever I go to a doctor, and I do frequently because of heart issues, they always ask me the same thing: do you smoke? Now, I've never smoked a cigarette in my life, and so I assure them I do not smoke. But having read up on it, you have to realize that smoking really destroys your blood vessels. And what gives you your heart attacks and your heart problems? The vessels aren't healthy enough to do their work. So let me get into this. There are over 4,000 chemical substances in tobacco. I have a list of a few of them here, and I'll just read them off for you. Acetone, arsenic, benzene, cadmium, chlorine, formaldehyde, propylene glycol, ammonia, carbon monoxide, nitrogen sulfide, hydrogen sulfide, phenol, and acrolein. Now, that's just a few. There are 4,000, but these are some of the ones that are in cigarettes. Now, what happens with cigarettes, what happens with tobacco, is that it destroys blood vessels. And so if your heart is compromised, or you have some kind of a disorder where the blood vessels are compromised, it would be a good thing not to be smoking. It also gives heart trouble, and it gives lung trouble. So smoking is not good, no matter how you talk about it. And I realized as I was watching television the other day, there's some kind of a class action lawsuit against tobacco companies for giving children sample packs of cigarettes, little packs of cigarette samples. And they did it, and when the children are young, they accept it, and nobody ever thinks about it. They don't do it anymore, but that's before they understood the cancer risk, because tobacco causes cancer. And I can remember with my parents, I had foot problems. I wore special shoes, so my parents took me to get another pair of shoes. My feet had grown, and I'm sitting in the shoe store, being waited on, and this guy walks by with sample packs of cigarettes. They're about this big as I remember them. They're small. They probably have miniature, maybe 5 or 6 miniature cigarettes in it. I never opened it. I never got it. But the lawsuit is if you were given sample packs as a child, and if you started smoking and you now have cancer, you can join this class action lawsuit, and you may be able to get a lot of money because there will be some kind of a judgment against the tobacco company for doing this. But I can remember those sample packs. They're in little brightly colored boxes, and when they asked me, the man came by, would you like to have some cigarettes? Now, I probably was about 9 at the time. And I said no. I really wasn't interested. And my parents were with me, and my parents said no. But he turned around and he faced me. He says, would you like these cigarettes, these sample cigarettes? And I said no. And then he walked away. He was going to give them to me whether my parents wanted to do it or not. So you see that there is a lawsuit because of that. So here are the harmful effects of tobacco. It gives lung cancer. That's kind of proven. 8% of deaths in men due to lung cancer. 4% in women due to lung cancer. Smoking causes 90% of lung cancer in men and 70% of lung cancer in women. I guess not as many women smoke as men, but it is a cause of lung cancer. It also gives bronchitis, emphysema, and what causes problems in breathing, coughing up material from your lungs, and tens of thousands of people die every year because of respiratory failure. Their lungs just cannot work, and they're coated, you see, because of the smoking. It will give mouth cancer, lip cancer, throat cancer, coronary artery disease, which is the most common cause of death in middle-aged men, also one of the most common causes of death in women. It causes artery damages, and the damage to the arteries in the legs and damage to the arteries in the peripheral part of the bodies. Now, what I'm talking about in the periphery, that's going to be your hands and your feet. In other words, the kind of outer areas of your body. And it causes vascular disease. Now, vascular disease is disease in the blood vessels. When I went recently to a vascular surgeon because of carotid artery problems, they sent me to a vascular surgeon. And what the vascular surgeon does, is to work with the blood vessels. That's what that word means. It also gives neuropathy. And in the brain, it can give damage to the arteries in the brain, and you can end up by having strokes. So if you are a person who has any kind of a heart problem, any kind of problems with your blood vessels, if you are at a stroke risk, you really need to stop smoking. I can't tell you what to do, but you really need to stop smoking. Then you make your own decision. Now, smoking during pregnancies causes the babies, and the babies are less able to survive. They're less likely to survive if the baby has a problem. It can give asthma, and it can give respiratory illness to babies, as well as adults. And the secondhand smoke, which is like a passive smoking, that's what it's called, but it's secondhand smoke. It causes coughing, wheezing, watering eyes, and things like that. So even if you're not smoking, but you're in an area where people are smoking, the secondhand smoke can be almost as dangerous as if you were smoking yourself. Now, what about blood pressure and other things concerned with smoking? Well, the blood pressure goes higher. The nicotine is a substance in tobacco, and the nicotine causes addiction to tobacco, and it acts like a tranquilizer. It causes the release of epinephrine, which is a neurotransmitter, into the smoker's bloodstream, and it causes the blood pressure to rise, and that's how it does it. Carbon monoxide goes from the lungs to the bloodstream, and it competes with the oxygen in your blood, so it combines with the hemoglobin into interferes with oxygen and gets into the tissues and causes hardening of the arteries. So that's kind of in a nutshell. I can repeat this. It acts as, we're talking about tobacco, it acts as a tranquilizer. It causes the release of epinephrine into the smoker's bloodstream, which causes the blood pressure to rise, and you have carbon monoxide, which goes from the lungs into the bloodstream due to the smoking, and it competes with oxygen and combines with the hemoglobin in the blood. So therefore it interferes with the oxygen getting to the tissues, and it causes hardening of the arteries. That's kind of in a nutshell what's happening to your arteries if you smoke. Now, the chemicals in cigarette smoke increase the activity of liver enzymes. So the liver enzymes go up. Now, if you are ill with anything, they will check the liver. Every so often you'll have a liver check, and they'll check the enzymes of the liver. And if the liver enzymes go above a certain point, then your liver is in trouble. So you can have medium, there is a disease called Berger's disease. It's not common, but it's an obstruction of the small and medium-sized arteries and veins due to inflammation that's caused by smoking. They don't know how this disease exactly gets started, but only smokers have it. Nobody else gets it. You spell it Buerger', Berger's disease. And so we get an obstruction of the small and the medium-sized blood vessels, and it is caused by inflammation. Inflammation is caused by smoking. Now, what about COPD? COPD stands for chronic obstructive pulmonary disease. A lot of people have it. It's caused by smoking. And if you stop smoking, it helps. This is a really bad disease. People end up on oxygen, and they're not able to get off oxygen. Your lungs are so disabled that you just can't take the air in. You have a disabling shortness of breath. You have muscle spasms, inflammation, secretions are coughed up, and you need oxygen therapy, and eventually it causes heart failure. I know I've seen people with COPD. When I used to go in for heart rehab from surgery, they would be going into another part of the building for COPD, for lung rehab. And it was hard for them. They could hardly walk. Some of them just can't walk without their oxygen. They have to have their oxygen all the time. Now, some of these effects that I'm talking about, and they sound dire, and they are dire, partly it depends upon how much nicotine and how much smoking you do. Because the more you smoke, the worse it gets. And one of the things that you're told is if you stop smoking, you will be a lot better. You will start getting better. So it behooves you to think about quitting, and I can't tell you what to do on a show like this, but I can give you the information that you need to make a decision. Here are the benefits of quitting smoking. The blood pressure and the pulse rate is going to be more normal within 20 minutes. So you see, you get a really fast normalcy. Oxygen in the blood becomes normal in about 8 hours. The heart attack risk drops within 24 hours after you have stopped smoking. The smell and the taste will improve in about 2 days. And the breathing and lung capacity will be better in about 3 days. The circulation is better anywhere from 2 weeks to 3 months. That takes some time. You will get better in 1 to 9 months. You'll have more energy. The respiration is better. The sinus problems are relieved. The breathing is relieved. There's less coughing. So should you decide to quit, then you have a lot of benefits from that. Now, if you're using cigarettes, if you're smoking, the nicotine does not have any symptoms. You know, you're not going to be staggering down the street. You just have a cigarette in your mouth. So there's not going to be any symptoms that you can say, well, when I smoke, this is what happens to me. The things that happen to you in terms of damage are happening internally, and you're not necessarily aware of it. You don't necessarily feel it until suddenly you get sick, and then it's obvious what happened when you're tested, and they can tell you, well, you damaged this by smoking, or you did that. I knew a guy, he was hypoglycemic, And he went to a doctor, and the doctor was able to tell. I don't know how he was able to tell, but he says, I can tell by your breathing exactly how many cigarettes you've had today. He says, today you've had 19 cigarettes. And the man that I knew said he was right. He knew exactly. Or he'd go to a doctor and say, well, it's been 5 cigarettes. There was some change in his lungs or some change in his breathing that he was able to nail it, and he knew exactly how many cigarettes the man had. Well, he stopped smoking and eventually just smoked no more. But so you don't have symptoms when you're doing it, but you do have withdrawal symptoms when you stop. And these are the withdrawal symptoms from nicotine. Craving, you will have craving, you will be irritable, angry, frustrated, you'll have anxiety, a lack of concentration, you'll be restless, you'll have a slower heart rate, you will have weight gain, tremor, headache, and insomnia. Withdrawal symptoms begin 24 hours after the last cigarette that you smoked. You know, why do people use drugs? Well, partly because the withdrawal symptoms are so bad that they continue to use drugs to prevent the withdrawal symptoms. And I mentioned that before. It's very hard to get off drugs because then you have to fight the withdrawal symptoms, which can be very serious. Now, you don't have any symptoms when you're smoking. As I said before, all the damage is occurring internally. You're not necessarily aware of it. But when you stop smoking, smoking is very hard to get away from. I've known people that have stopped smoking for 3 or 4 weeks, and they just go right back to smoking again. And they go into programs to help them stop smoking, and they're successful, and they say, this is terrific, I don't have to smoke. A month they're smoking again. So it's a hard thing to kick, but you'll find that if you decrease your smoking and stop it, your health is going to vastly improve. Now, nicotine stimulates the sympathetic nervous system, and so you have an increased heart rate, increased blood pressure, increased oxygen consumption, and it also contracts the gastric muscles. So you have a host of things that are happening if you smoke. And you may not, as I said before, you may not be aware of what those things are, but you have a host of things happening to you when you smoke. I don't know why anybody would try to give cigarettes to a child. I was fortunate because my parents never smoked. There were no cigarettes in the house, so therefore I wasn't tempted, and I couldn't say, well, my parents did it, so it must be all right. Children learn what they live. And that if they live in a house with smoking, they just assume that's normal. If they live in a house with drinking, they just assume that's normal. They live according to what their parents have taught them. And if they've taught them it's normal, then to them it is normal. So when they get out in the world and they have cigarettes, it doesn't bother them. My parents did it, my grandparents did it, everybody does it, it's okay. When I went to college, there were people who were smoking, some of my friends who were smoking, and we were like in an undergraduate degree program. We'd be sophomores or juniors, and they would pick up cigarettes. But I was fortunate, and no one tried to get me to do it. You know, if anyone offered me a cigarette, I just said, no, thank you, I don't smoke, and nobody pushed it. There wasn't the pressure for me to do it. My brother took up smoking for a while, but then he eventually dropped it. And so therefore, we basically had a no-smoking house. And it was better for me. It certainly was better when I had heart surgery. And I had a nephew come to me and said, I'm going to give up smoking because I know you've just had heart surgery. I don't want to be in a position where I ever have heart surgery and I've smoked. I've seen people who are chain smokers and they cough and cough and cough and they can't stop coughing. I was concerned about one lady, and I told a friend of mine, she's coughing all the time. And she says, it's a smoker's cough. She can't stop coughing. But she ended up by having serious lung problems. You know, I made the decision early in life that I didn't want to damage my body by putting things in it. that was not good for it. And so I never smoked, and I never drank, and I never used drugs. And it came in very handy for me when I developed health problems later on, because I never had to try to stop anything I didn't start. And so therefore it was good that I never did smoke. Now I'm going to mention just a little bit about e-cigarettes, and then we'll close because I'm almost out of time. The electronic cigarettes, they're used by people as a substitute for cigarettes. No nicotine gets in the air, but you do get nicotine in your system because those e-cigarettes use a liquid kind of nicotine, and you do get that, and you can get poisoned by it. I know some of the e-cigarettes, you could get them in different flavors, or whatever you're smoking, whatever you're inhaling, it could be in different flavors. But the problem is, even though the nicotine is not released in the air, it's still in your body. So you think you're going to cut down on smoking real cigarettes because you're using something electronic. The other thing is that sometimes you can get serious burns from them. Sometimes they actually catch fire. I mean, there's a lot of things about these e-cigarettes that are not very good. So I'm thinking the popularity of them may go down. I know places that don't allow you to smoke will somehow let you use e-cigarettes, but sometimes they're banning it altogether. No e-cigarettes, no smoking, no nothing. And that's the way it is, I think, in the place where we live, which is not a problem to me because I don't smoke anyway. So it's a health risk. Smoking is a health risk. It's not going to make you drunk. It's not going to give you hallucinations. You're not going to go staggering down the street, but you're going to have a lot of internal damage to your lungs, to your arteries, to your heart. And so if you are actually interested in stopping, there are programs available that you can join up which will help you to stop. Some people stop cold turkey. It's hard to do it though. When cigarettes get in your system and you feel that you need it, it's like any other drug. You take it because you need it, not because you want it. Even though you've decided you don't want it anymore, your body demands it, and it makes it very, very difficult to get off from drugs, and also that includes cigarettes. So we're about out of time. I'm going to stop it here, and next time I'm going to spend some time with caffeine, which everybody uses, or almost everybody uses, and then go on from there. So please join me next time.